Welcome to the Studio Chat podcast, the podcast designed to be your companion in the journey of self-discovery. I'm Barbara Thompson, your host, and a dedicated therapist. I'm the founder and owner of Self-Care Studio, a private counselling practice. With my clients and courses that I create on this podcast, I'm committed to ensuring that you have the support that you need. I created this podcast as a space for you to feel a sense of connection and a reminder that you're not alone in this thing that we call life, this adventure. This podcast is your weekly reminder to trust yourself, live life authentically, and embrace the path that is uniquely yours. Together, we'll explore ways to break free from people-pleasing, overthinking, allowing you to claim your time and energy to live life on your terms. You'll be joined by myself as I take you through some episodes, or during the year, I'll have some special self-care experts as guests on my podcast. So if you're ready to step into a life that's truly for you, join me on this journey. Let's navigate the twists and turns of life together, and more importantly, live your life for you. So thank you so much for choosing to spend some time with me today. Let the Studio Chat begin. Hello, everyone. Welcome back to the Studio Chat podcast. I'd love to introduce Belinda Clark to you today. She is an osteopath, and I have been wanting her to be on my podcast for the longest time. So I'm so stoked to have you here, Belinda. Hello, welcome to the Studio Chat podcast.
Hello, thank you for having me. Thanks for your patience in having me.
Oh, I'm thrilled to have you on here today because I think your modality and what you do, more people need to know about it. And having a podcast is such a cool way that someone can just plug this into their ears when they're going for a walk or doing something around the house, and they can learn all about, what does an osteopath do and what it sounds and looks like. So can you please share with us a little bit about you and what led you to become an osteopath?
Well, I came across osteo when I was working as a chef about 10 years ago or so, 8 years ago. And I was going to see an osteopath for headaches, which I'd had for a very long time. And she was just great. And within, I was seeing a few different practitioners before coming across osteo, and was always just going very regularly and needing something else to keep me going. And then I saw this lady maybe a few times, and she showed me a few things, and then I didn't have headaches anymore. And just loved it. I saw the world completely differently. It was like when I got glasses for the first time. It's like, is this what people see? Is this how they live their lives? And then, I just became super interested in it. But working as a chef, and then one day just, applied for osteo when I was crying in the cool room with a really mean head chef. I was like, this can't be my life. I'm just going to do something different. I don't care what it is. Came across osteo and got in, and then did a few weeks of it and just loved it. And then that sold.
Wow. That's such a powerful story, because not only is it something that you've experienced yourself, that you were having really, and I think like you've mentioned to me before that your headaches were they very severe and you had them for a long period of time?
I just, I'd honestly just always had a headache, and I don't think until I didn't have a headache that I actually knew that I had a headache. It was sort of just this dull kind of gross feeling in my head that was just like, oh, that's just what my head feels like. And then, it wasn't until that clear sort of brain of not having a headache that, I kind of realized just how debilitating they were. And I would always just carry Panadol in my purse everywhere I went. I would have a packet of Panadol because you just need it. And then, I sort of just stopped needing that. And it was the absence of it that I think really brought my attention to it. And now, even now, if I get a headache, I'm so sensitive to it, because it's like, whoa, there's this huge part of my life and it's back, but then it goes away within half an hour and it's fine. But there's definitely a sensitivity towards them now because of how bad it was for so long.
Yeah. I think it's a common thing. A lot of people have a health element or something that's happening to them, and they actually go and see other people and try and do the right thing, and it doesn't relieve it. And then had you heard of an osteopath before? Have you heard of that line of work, or was it just something you literally stumbled across?
Yeah, I literally just stumbled across it because I couldn't get in with the guy I normally saw. And it was just like a clinic just down the road. And I was like, oh, I'll just see if they've got someone in today because I need something now. And I just, got in with a lady called Rebecca. And I so often think I should just email her and be like, you changed my life without having any idea.
Yeah, it changed your life on many ways, that the headaches, but also your career. And it sounds, it made a profound change in your life.
Yeah. But no, I'd never heard of it. And only we still get patients in all the time who have never heard of osteo. And it's like, oh, I've tried everything else. And then they just stumble across us or someone else suggests it. But not often do people come to us as the first option unless they've heard of us through someone else.
Yeah, that's a common thing. I haven't really heard of it, and I don't really know, what it is. So is there an easy way to describe what it is to someone like myself that may not be familiar with what you do as an osteopath?
I mean, I guess the common answer, or the quick answer anyway, is we're like a combination of all the other hands-on sort of therapists, where we can sort of do a little bit of physio and chiro and massage and put all of that together into one, and our more of a holistic view of looking at the whole person and every system of their body and how that leads them to wherever they are now. Whereas, I think, and I never will say anything bad about any other profession because we all do things differently and it depends on who you see, where you see them, etc. And what you need from them as well. But in general, we're a bit more broad looking. We'll try to look at the whole picture and everything that's led you up to there, and then all of the goals leading forward as well, and try to piece that together.
So you're not only a form of helping someone that would have come to you with something, it sounds like you're also preventative as well. So you try and give your patients something that, hey, in the future, just, kind of stop them from getting things.
Exactly. And I think that, it's becoming, and even at the moment, there's such a wellness kind of trend where people are really happy to put the effort in to prevent stuff and maintain feeling good, as opposed to just getting a treatment when something goes bad. It's not bad anymore, stop getting a treatment.
And I think too, you hit the nail on the head when you shared your story, and thank you for sharing that, because I think a lot of people can resonate that until people start drinking more water or move their body for half an hour every day, or God forbid someone gets 8 hours of sleep a night, you don't realize how those small changes, and then people are oh, I don't know what it feels like. Is this what normal is this what healthy feels? Is this what normal feels? Because most people have had something for such a long time that they've learned to live with it.
Yeah, definitely. And people right? And what people just learn to tolerate or just accept for their body, oh yeah, I've got a sore shoulder, but it's always been like that, so not what I'm here for. And it's but it's completely connected to your neck and you're here for your neck. Maybe it's got something to do with the shoulder. But
yeah. Or people just are afraid, and I'd understand that too. Coming to see you, a lot of people would think that seeing an osteopath is similar to other practitioners where you just lie on the bed and they do some stuff to you. But I think what you do, we're going to go into it shortly, it's a little bit different with what you guys do. But one of the first things I want to talk to you about is something that I think is really important in today's world, is the nervous system, and something called the rest and digest, which I feel is all related to stress and anxiety. So I'm sure, do you see this on a regular basis, that everything some things are connected to the nervous system or the rest and digest, or stress and anxiety? Is that I know there's a lot going on in there that I've just talked about, but is that something you see on a daily basis?
Yeah, for sure. And even just in people come in pain, and when you're in pain, your nervous system is naturally in a bit more of that sympathetic, like fight and flight sort of response, and healing essentially occurs in the parasympathetic state where rest and digest and like all of the body functions get restored, and that's when you sort of feel safe in your body and you can relax and let your system relax. So often, like, I guess you see lots of people with headaches or just tension or pain for whatever reason, and then they're stressed about it because it's interfering with their life in some way they don't want it to, or like interfering with their work or whatever section. And it is about just like bringing them back into a state of, okay, your system is safe, your body is safe, and it's going to be okay. And even like, and for some people it is just lie down and let me do something to you so that it is relaxing and can calm down. Other people, it'll more like movement or giving them things to actively do at home as well. And it depends on the person and their goals. But yeah, I would say most people are in some state, and just like the world we live in at the minute is pretty like activating through your sympathetic nervous system.
I know, it's so easy to get them mixed up because you'd think that the sympathetic nervous system is the nice one, but it's not. So it's that's kind of how I always think about that too when I'm talking with the client. But one thing people don't realize is something about osteopath, like that you and I have spoken about before, is you do something really cool that when you're working with someone, I'm going to explain it in Barbara terms and you can come back to me in the clinical terms, but it's more like how you described it to me is that you make room for the organs and you make room for things to do what they need to do in the body and give them space to breathe. Can you explain a little bit more to someone listening to that, like what that means? Because I was really fascinated by that.
So I will go into the organ stuff as well, but one of like the guiding principles of osteo is that the body is a self-healing mechanism given the right environment. So essentially the current state of the world is not the right environment to live your absolute best life in bliss. So we sort of create a space where it's like, okay, your body can relax. You don't have to be doing all these million other things. Your body can heal itself given the right environment. So we try to create the right environment, and whether that's with like balancing off like muscle tension and joint positioning and pain and everything, helps create an environment that is better or more conducive for your body to do what it needs to do. And then where I sort of do a bit more work is with either breathing or the visceral manipulation, where it's a lot of your organs as well function with the parasympathetic tone. So creating an environment where your organs in your belly are moving well and have good blood supply and nerve supply and all of that, help, again, your body to do what it's meant to do as easily as it's meant to do it. So your body's really good at compensating and it will just get the things done. But is that the most efficient or the easiest way for it to do it? Maybe not. So we kind of come in and just help the blood flow, help the nerve sort of messages to those organs improve a little bit or become a bit easier anyway. So reduce some of the compensation patterns, hopefully, and then your body kind of just takes over and the rest unfolds as well. But the organ work is interesting because then it allows, again, it's like if your belly is moving and the organs in your abdomen are moving as they need to, it allows space for your diaphragm and your ribcage to move as easily as they need to, which then improves your breathing, which improves everything else. So it's a bit of a flow on, which is super annoying sometimes and then really helpful in other times where everything is connected and everything is like chicken or the egg through your whole body, which is annoying in some ways where it's like, okay, and then things spiral really quick and all of a sudden everything's included. But it's also great in that you address one part and then that flows on and everything's better. Yeah. So it can go in both directions. But a lot of it is just finding that access point of what is meeting your person or your patient where they're at and what they can do. And sometimes they'll come to you and they just need to lie on a table and for me to do something to them, and that's fine. And then they start feeling a bit better and whatever, and then like, okay, they're now really ready to change and be like an active player in their own health and start doing a few more exercises at home and start eating better and sleeping better and all of that. So it does flow on, and once you feel good, you stay feeling good. It's
It's like a knock-on effect, and you kind of do, it's a stepped process. And I'm quite fascinated when you said like you can work on the stomach area and get everything moving again, because everything's quite tight, especially with the visceral part of things. Everything's kind of stuck and inflamed and not flowing and not moving. And it was interesting that like when you work on the stomach area and get everything moving means like people are going to have regular bowel movements. And this is something it blows my mind for anyone listening out there. Like obviously there's kind of a couple of camps, and you know these people in your life. I've got these people in my life. I'm sure you do too. There's some people that just have diarrhea all the time, and that's just their life, and they kind of just live with it. And there's some people that just never poop. And it's interesting as a counselor, I work on a holistic level too, that I always ask, like, with the period, if I'm working with a woman, like, where's their cycle at or where they're at. But I also do tend to, if they are really blocked up with emotions, it's an interesting conversation I have with a client. I'm like, when was the last time you went to the bathroom? And they're like, I'm here for therapy. I'm not here to talk about my poo. And I'm like, well, it's actually all connected. And the number of people that have to look at me and they're like, I know, and you'll be the same. When you say to someone, oh, when was the last time you poo? And people have to go, oh, I'm like, are you kidding me? You have to, and 3 or 4 days. Oh, was it 3 or 4 days ago? And I'm like, oh my God, so you're basically full of shit. And it's so interesting that everything you eat and do, like the body is a constant cleansing system. It's constantly cleansing itself. And how crappy people must feel if they're not doing a nice good poo or a couple of them every day.
Yep. It is pretty amazing. And then also just amazing, like as soon as you touch someone's belly and you can feel it all moving, they're like, oh, sorry, I haven't eaten. I'm like, no, this is what it's like. It should feel like there should be movement in your tummy. Like, yeah, we do a lot of work in restoring the blood flow and the movement through the bowels, which from like just a straight mechanical point, like if you're full of shit, literally, you feel gross, you feel heavy, you sort of like drag your body like slump to like create space through your belly, and then puts a lot of pressure on your back and puts pressure onto your like down into your pelvis, and then your legs feel a bit funny, and like again it all just spirals on. But if you can get that moving, do a nice big poo, which again is like the rest and digest. It's like your body can't do a poo if you're constantly stressed, or it could go the other way and then it's just as dysfunctional anyway.
Yeah.
But you do a poo, you feel great, you feel lighter, your mood feels lighter, you lift, like you sit up taller because you've got space to actually pull your spine away from your like from your colon. Like your belly isn't literally pulling you forward. A thing that I'll often do, which the podcast people can't see, but if there's so much tension through your abdomen, it's like having a t-shirt with a huge knot in the front, like it's going to pull you forward. And that's something that we try to do, is like loosen up all of the fascia and all of the connective tissue through the front of your body so that you can literally sit up straight. But even just in your mental health, like, if you feel gross in your tummy, you're not walking around in this big proud posture, like you're slouching, you're feeling gross, your mood is low, your neck's poking forward, like everything changes pretty quickly. Getting it moving, and people just, I think the flow and effect of that is pretty massive. Like sometimes when I've seen patients for back pain and I've ended up just doing a bunch of work through their abdomen, because it's like your bowels are hanging off somewhere from your lower spine. If they're full and really tight and not moving, it's like a two-way sort of train station of signals, input and output from your spine. So if the organ's really irritated, it will feed information to that spinal level. which if there are too many things feeding the same information or feeding information to that same level, the brain gets confused and just be like, oh, we'll just put information everywhere because like something has to happen at that level. We don't know what it is because there's too much to filter through. We'll just do everything. And that's when you can get a lot of like the referral pain or just that like dull, achy lower back pain. It's like, is that coming from the organ or from the back? We don't know, but you have to treat both. But yeah, people come in with back pain, you treat their organs, and then like, I did the greatest poo after your session. I don't know what you did. And I was like, okay. And then they just want you to do their belly again because they didn't realize that that was part of the issue. Like they're not coming to me because they're constipated. They're coming to me because they've got a sore back.
Yeah, that's fascinating. It's interesting too, because if anyone's thinking, if you've been to a chiro or a physio before or for a massage before, how many of us that are listening right now have had our stomachs touched in a certain way that's massaged for therapeutic reasons? Like I went for a lymphatic drainage, one of my first lymph massages, I want to say a month or two ago. And how old am I? Early 40s. It's the first time I've had some kind of what's the word? Remedial work or anything. Someone touching my stomach. Like that was quite uncomfortable at first, but once I got around it and I've done my own reading about it and found all these amazing benefits, I'm like, hey, how did I not know about this before? But also once you feel comfortable, and it's a bit weird at first, someone massaging your stomach, because for a lot of us, your stomach is kind of, it's a place that not many people touch. It's like a little sacred area,
And especially like body confidence and stuff, like a lot of techniques. And from when I was getting it done to me, when we're learning them, it's like some strangers coming and grabbing all of the rolls in your tummy. Like this isn't super comfortable.
Yeah.
But you have to relax for us to like access through as well. But at the same time, it is kind of nice just to sit there and, like you were saying before this podcast, just get comfortable with being a little bit uncomfortable because it's going to be great.
Yeah.
Like, yeah, someone is allowed to touch my belly because it's not this area I have to hide and protect and feel shame over. It's like, this is just an area, it's part of my body. You treat it like every other muscle and organ and ligament. Like it's just a part of you. We don't need to protect everything, like hide everything.
Yeah. It's so
weird.
neglected. It's so neglected, the area, isn't it? Especially in your line of work. That's a big hub of the body. That's where all the exciting stuff happens. And it's everything else is treated but the stomach area. So, and I, as a therapist, hear so many people that sit in front of me and they're like, oh, my stomach's sore because I'm bloated, or like, again, the constipation, the diarrhea, or I've got stomach pains, or like I'm gluten intolerant or I'm dairy. And part of the time that's all BS. It's just there's other stuff that's going on with the body. So anyway, I wanted to just to mark that, because this is what the line of work that you do is incredible for that area. And another line of stuff, you briefly mentioned it, that osteo work also with what you do especially, is you focus on the breath work and breath.
Yeah. So I'll do a lot of work, and I've done a few extra courses in treating integrative breathing therapy, where looking at the rib cage specifically from like a 360-degree view of how is it actually designed to function, and then improving that. So, which is very different. And I'm sort of having a bit of a battle at the moment with how like trendy breath work is at the minute with Wim Hof and all of these like hugely powerful breathwork techniques, which it's amazing that it has become so popular because it's so good for you. And I sort of take a step back and be like, okay, are you breathing well? Are you practicing all of these crazy breathing techniques with good techniques? Like if you go to a gym, do a deadlift, like you want to be doing the deadlift well before you practice 1,000 of them with however many weights. So a lot of time people are breathing and either just like really shallow up and sort of towards their neck. Like when you breathe in, your diaphragm is meant to come down, which forces your rib cage open wide. instead of, if you breathe in and you're moving up and down, that's not quite the right pattern we want. So when you breathe in, you want to feel like you're going in and out sideways. I can see you trying to do it and you're very aware.
I was doing it and I'm like, I'm so up and down. Uh-oh.
You try to move your head and then be like, no. Yeah, you'll see people be like, take a big breath in, and they like just arch all the way back up. I'm like, okay. And
Did
again,
I do that?
yeah, they'll be like,
Oh, I subtly went.
yeah. No,
My shoulders are going up and down. So yeah, I'm very up and down. So what is that caused by? If someone's listening to this now, everyone, I want you to do a big deep breath in.
Take a breath in and just notice if your body moves like sideways, like gets wider or gets longer.
No, I'm different. When you breathe in, it feels like it goes up and then down. So obviously, yeah. So what is that? How can we improve that by, instead of going, I guess quite common, like up and down, how do we go to how we're supposed to be doing it?
There's a lot of practice. Initially, it's just becoming aware of where your diaphragm actually is and what it's meant to do. So I'll often get you to put your hands like on the side of your rib cage, sort of underneath where your brow would be sitting.
Yeah.
And then taking a breath in, and you want it to feel like your hands are moving sideways. And then when you breathe out, your hands come back towards the midline.
Yeah, I can feel like my ribs going out to the side and yeah.
So often that's the first thing, is just that brain connection to what you're trying to do. So that's why having your hands there is going to be much easier than initially when you did it.
Oh, yeah.
So even if you don't have your hands there, that's like stage 2 is still trying to do that movement without your hands telling your brain where to go or where to aim for. But the way that it's like contracting your diaphragm is this big flat muscle that separates like your lung, like thoracic cavity, to your abdominal cavity. So all of your organs sit underneath your diaphragm, then your lungs and your heart and everything else sits above it. As it contracts, it sort of flattens down almost like a parachute. Is that a good example? I don't know. Yep. It flattens down, which, because around the edges it's attached to your rib cage. As it flattens and contracts, your rib cage just naturally spreads wide. So if your rib cage either doesn't have the capacity to move, if the joints through the back or your sternum are really constricted and tight, that will be really hard and your diaphragm will have a lot of resistance. Or if the organs in your abdomen are all really congested or bloated or whatever, pressing up underneath it, again, it's just like resistance training for your diaphragm. So your diaphragm can't come down if there's so much pressure in your abdomen that it's not going to move and make space. And then also, if you just don't know how to contract your diaphragm properly, but your diaphragm is a muscle that's like, you can control it, but if you're not purposely controlling it, it's just moving anyway. Like breathing is one of those functions that it's going to happen automatically, but you can also influence it. Whereas your heart rate sort of just happens. You don't necessarily change it. You can a little bit with breathing, but it will keep happening. But you can just learn to control it and control it in different ways. And like the way that I'll teach it is initially literally just sitting there practicing like, where is your diaphragm? Can your ribs actually move? And then going through a sequence of different postures, and each posture sort of progressively challenges that whole system. So if you can sit there perfectly still and breathe in a really relaxed environment, great. But in life, you still have to breathe well in a heap of other environments where your abdomen's contracting or you're bending forward or you're reaching for something. Like, you still, within movement and within different stresses, and especially like exercise, you still need to be able to move well. And if you're not, that's when you end up getting like really tight neck and jaw and shoulders and everything, because your little neck's trying to like lift your rib cage up from your shoulders instead of your diaphragm just making space in your belly. So yeah, it was like, hey, me.
Yeah, it's probably me and everyone else. Interesting, because I know that the breath is the only thing, correct me if you know, but I believe that the breath is the only thing that can really pull your nervous system back into the sympathetic nervous system. Like, you can meditate and you can do all that kind of stuff, but the only thing that's going to, obviously, if you're highly anxious or you're having a panic attack, please don't try this. But if you're not either of those things, the breath is something that will bring your body back to balance, back to the rest and digest, isn't it?
Yeah, I think, and I don't know if it's the only thing, but it's certainly a really easy thing that you can interrupt and control. So you can very quickly take control of the way you're breathing and directly influence your nervous system.
Yeah.
So yeah, I'm sure there's lots of other ways to bring your system down, but that's just a really quick way. In like any situation, you can very quickly change the way that you're breathing and it will immediately change how you're feeling.
Yeah, it's amazing. It really is. And when we talk about stress and tension, and a lot of people these days are on their devices, on their phone, so their neck is kind of perched forward. A lot of us, a lot of people, work from home. So have you noticed the difference in people's postures, especially since after COVID and that, with people being on their phones or people working from home on their laptops, with all the tightness around the neck? Like, I presume that a lot of people would see you for neck pain and shoulder pain and back pain.
Yeah. Yeah. Neck and shoulder, headaches and jaw and stuff is probably what I see the most of. Definitely postures, sort of, it comes in waves, I think, and posture is a big one, but I'm sort of like, so long as you're moving regularly, it doesn't really matter what posture you're in. Like, any posture is going to get tiring at some stage. And any posture that, yeah, if you sit for too long, or if you lie for too long, or if you exercise for too long, it's going to, like, you will fatigue if you only do that. So yeah, upper neck posture is an interesting one with breathing and tension, because generally the like tighter you are through your neck and your jaw, it sort of creates a bit of a vicious cycle, and then you end up having to kind of bring your head more and more forward to maintain like the airway down your neck as well. So that can be a vicious cycle pretty quickly with stress and work and sitting in a computer. Like, I don't know, I don't do it. Just like deep in an email kind of thing, where you get an email, you get stressed, you lean forward, you're there, and then you don't move for however long, and you've probably held your breath for half that time, just not doing anything. So it's just taking a step back and moving. And I'll often tell patients, like, as a way to keep interrupting that natural breathing cycle of, like, so long as you're changing the pattern often, it doesn't matter what pattern you're doing. But yeah, it's like, just every time you open an email, every time you do whatever task that happens a million times a day, that would naturally create a little bit of stress. Be like, okay, I'm just going to do one breath and then do that thing. So it's just like tweaking the, I don't know, the interaction a little bit. So it kind of starts to downregulate anyway. But yeah, posture's a funny one. Like, I'm not super strict on it, to be honest, where obviously there's better and worse postures, but my thoughts are, so long as it's like changing, do whatever you want. And then comes into that workshop I was saying on the weekend. With sitting, like, we don't have to sit on a chair. Like, you can be at a desk kneeling or like moving. You can put your computer on the floor. You can put your computer on a chair and sit on the floor for a little bit. Like, even like, oh, I've got a sit stand desk. It's like, okay, how often do you change it? And they're like, oh, maybe once a day. And it's still 4 or 5 hours in one position. So yeah, I think it doesn't really matter what you're doing, so long as you're changing it quite often.
Yeah, because we all get into autopilot, or we all get into being busy and just unaware of this stuff. So it's simple stuff, but if we just don't think about it, or we're not aware, we can't change it. One thing I experience myself, but I also know a lot of people do, when they're stressed or they're tired. I find that there's been an increase in people that have jaw pain. and whether that jaw pain comes from clenching their teeth at night or just clenching their jaw because they're stressed, or that was something that I learned too, that osteo work can help with if anyone's listening to this and you do have jaw pain, to see an osteo.
Yeah, definitely. There's a lot like with muscle attachments and like joint positioning all through your jaw and your like actual skull and then the top of your neck, but as well as that, like the fascia down from the front, like all the way underneath your chin down into your whole belly, it's all connected. So again, if you're really tight through your belly or if you're really tight through your jaw, it's just pulling on every other area. A lot of it with like your tongue posture as well in your mouth. Like you don't often think, what is my tongue doing? But jaw tension and tongue positioning are a huge one. And again, then vicious cycle in that, like the layers of connective tissue around the top of your neck in the same rings of tissue are the jaw muscles and like the upper back of the neck muscles. So if there's tension in the back or the front, same rings, there'll be tension in the other. And then, you end up coming into these compensation patterns or postures to offload the other area. But osteo, will work through like the upper part of the neck, all through the chest, through the jaw on both the outside and the inside. That's a fun technique if you haven't had that done, is we'll pop a glove on and like come up the inside of your cheek, and it can be super painful, but it gives a lot of relief pretty quickly. Where it's like side to side, like even if you notice when you're opening your mouth, if your jaw like deviates one side or the other, yours is pretty good just then. So you Jane. Again, just muscle imbalance from side to side. Or if like, do you always chew on one side of your mouth, and is that because it's uncomfortable to do it on the other, or because it just doesn't work? And try it out. Like, again, just changing postures. So if you always do something, or if like, and I just noticed me doing it, if you always lean onto your hand, but it's always the same side, which often, or if you always have your phone on one side and you're tilting your neck side to side, or if you always sleep on your tummy with your head facing one way, that's going to compress through the jaw, and then that create a little rotation through the top of your neck as well. And generally, like, we're creatures of habit, and we always do things the same side every time. So sometimes like swapping sides if you can, or just neutralizing completely.
We were talking about jaw pain the other day. You mentioned something about the position of the tongue in the mouth, and that you said often people that have tight jaws, whatever, the tongue is quite further back in the mouth. And ever since you mentioned that to me a couple of weeks ago, I'm like, holy shit, my tongue feels like it's definitely like short and it's like way down my throat. Like, so this is what I mean, the importance of awareness about your body. Until these conversations that you and I are having today, I hope it can help someone, or at least one person, to be like, oh, actually, how many times do I go to the toilet? Or actually, how is my neck feeling? Actually, how is my posture? Or actually, am I like Barbara, and I've just realized that my tongue feels like it's halfway down my throat? Huh.
Interesting. Didn't think I'd go to the osteo for my tongue.
Yeah. So I think my tongue needs some assistance.
It's interesting. And like your tongue, your diaphragm, and your pelvic floor, all sort of layers that work pretty together. So generally if there's, and like the tongue and like the roof of your mouth as well, they're all quite interrelated. So generally if there's issues in one, there'll be issues in the other. And again, back to flow on effect of everything. But often there's tension in your jaw if there's tension in breathing, and then same thing, if there's tension in breathing, there'll be tension in your pelvic floor. So there you go.
There you go. Wow. Oh, I need help. No, it's so cool because everything's connected. And who would have thought? The body is so fascinating. So I know that like osteopath work is a holistic approach. So that's what you mentioned before. You touched on that you look at lifestyle. I'm sure you consider lifestyle, stress, and other factors into your treatment plans when you see someone. So it's not like they may come to you because their jaw's sore or their back's sore, but that's where with osteo, you kind of look at the whole body as one.
Yeah. And we'll try to look at what factors and whether that's in their body or in their life that are feeding into that response, and what compensation patterns you either adopt or don't adopt as well. So often, like, is it stress? Is it tension? Is it you're actually just rushing everywhere and that's what you have to do? And or like different postures where it's like, can you actually change that or can't you? Some things they'll be like, I was treating a policeman the other day and has a really like a heavy belt all on one side. And it's like, okay, obviously that's going to create an imbalance and tension differences in your pelvis, and that's who's getting lower back pain with that. It's like some factors you can change, some you can't. And so then it's like the ones that you can or you can't change, you just work around it. So it's look at the whole picture, understand at what areas, and whether that's you can't change it or they're not ready to change those factors as well, all comes into it. And what are their goals? Like, are they happy to try doing something differently, or like, no, that's the easiest way, I want to keep doing that and I'll just work harder in other areas to balance it out. And I think just getting a good understanding of the actual patients, where they're at and what they're willing to change or adapt or what they're not, and then where they're actually hoping to get to. So I'll always try to look at the big picture. Some patients just want a quick fix and give them a couple of sessions and then they'll go on their way and come back in 6 months' time when they've done it again. Or you work through like a longer term plan and start working on that preventative kind of approach and influencing other areas of their life where they can modify things to just have that flow on effect into good sort of cycles. But also, different underlying conditions and stuff as well, like understanding how that will affect, or like hormone balance, how that affects your body and the function of your body and mental health, and therefore your postures and energy levels in general. And referring on, like when, we've got a nice little community of other practitioners around as well that you're just working together. It's like, I'm not going to be the one for everyone. I can understand there's all these different pockets of someone's life and they all need help, or some of them do. But kind of knowing as well where you can impact and what, okay, that's the main goal, I'll do that. Or, okay, I actually think you need to go and see someone else and come back to me once you've got these other areas a bit more manageable. I think, there's only so much we can do. Like, I've only got so much time and money to get appointments everywhere all the time. So finding what's right for that patient for the minute is probably how I like to look at it.
Yeah, and I really like that because I really get the feeling that you're not judgmental at all. So in your line of work, you have to get quite close to people, quite personal, asking personal questions, touching people. And I get this feeling after speaking with you a couple of times now that you scale your treatment plans, which I really love the sound of it, because a lot of people, I think, are fearful of going to see a health professional like yourself, because, oh God, I have to take my top off and you're going to see my rolls or my fat bits, or I just feel uncomfortable, or, oh, they're just going to try and upsell me all the time, or I actually just want a quick fix. But everyone that I always see, no, you have to have 6 sessions with me, or you have to have this. And I get the feeling that you're actually genuinely there to be like, okay, what's your concern? What do you need? And I feel like you really listen to your patients. And
try to.
That's a breath of fresh air. That's really nice, because that knows when I have clients and I refer them to you, I know that they're going to be taken care of. And really, I think part of the important thing is listening to what people need. And again, the awareness today of talking about what an osteo does is now it's like, oh, I've actually never thought of one. Maybe I will go and see Belinda. When we talk about the muscles in the body, obviously people are very familiar with physio work and stuff. How is your approach fairly similar when if someone comes to you and they've got like shoulder pain or something to do with their bicep, or can you help in that regard as well?
Yeah, definitely. It's depending on what the injury is, like, will be just the same as a physio would in that sense. Like, if you sprain your ankle, we can still treat a sprained ankle the same as you would if you went to see a physio. And I, to be honest, don't really know what physios do because I don't go to a physio, but everyone does things differently. And I think, yeah, very open that everyone does do things completely differently. I'll still treat, like, if someone comes in with a straight up sort of sports kind of injury, you just treat the areas around it that would have led to why was that area the one that failed on the day. And then, yeah, we still give exercises and rehab homework and things for them, suggest like modifications to whatever their actual activities are at the time as well. I'll often, yeah, I do refer quite a bit, like, and I will refer to physios depending on what the injury is. If it's like a surgery, reconstruction and something, and then they're coming to you for the rehab, like, I think physios are really good in that setting as well. And I would just refer, like, that's not my area of specialty, go to someone else.
Yeah.
It depends. Like, for most people, unless it's post-surgical, we would do pretty similar treatment plans in some ways, obviously looking at a few steps back. I think that's something that surprises me often. And again, I don't know, I'm sure it's not everyone. But when people have come in with a shoulder pain and no one's assessed their neck movement before, and that happens like more often than I'd be happy about. But it's like your neck is directly related, like it's connected the same muscles into your shoulder. So in my assessment, someone with a sore shoulder, you still have to address their neck and you still have to address their rib function and you still have to address their thoracics. Whereas I don't think people are like, oh no, it just hurts my shoulder. It's like, okay, but your shoulder is attached to all of those other areas. You can't move your shoulder without somehow moving those other areas as well. So therefore it's all related. Whereas, yeah, that might just be an osteo approach. I'm not sure.
Oh, I love that approach because it just gets people thinking that everything is connected, and it makes sense. It really, if we're looking at everything being connected, one thing is like preventative care, but also when people come to you for treatments, is osteo something that you need a couple of goes before you feel and notice a difference, or is it something that you could come in? I know this is kind of, I'm being vague, but you could walk in and get a treatment and walk away and be like, oh, okay, I feel pretty good. I feel different.
Case by case for everything,
Yeah.
and always going to be my answer, which is not so helpful. Sometimes, yeah, you should know, like, you'll notice a difference after one. It might not solve all of your problems forever, but you should definitely notice a difference after a treatment. Yeah. Okay, I feel different. And I often say after like an initial appointment anyway, essentially different is the goal. You just want to feel different, and whether that's better or worse, it's still made a change, and therefore your body is going to start reacting to that change and flow on effects again. So generally, yeah, it's common to feel a little bit like you've had work done. I'm often like, some strangers poked and prodded you for an hour, like your body is going to remember that and it's going to notice something different. So you will feel different after one. And then it's, again, how long does that change last? And that's where, in terms of treatment plans, depending on the injury or the case, I like to sort of scale it so you're not starting from scratch each time you see someone. So if something's super acute, it's going to be really sore. You might see them like maybe twice in a week, or at least like the next week, so that some of that change, like, oh, I had a treatment, felt pretty good for a few days and now it's back. You almost want to get your next treatment before it's like back to how it was.
Yeah.
And it will come, but it will change. And then over time, and as you do more like stuff at home and influence every other factor, those changes in between treatments seem to last longer, and you've got more tools at home to do it yourself at home, is my thought. We try. Yeah.
What's one thing that you hear often that when people are sitting in your treatment room, is there a question, like, because you've been an osteopath, how many years have you been an osteopath for now?
I think this is my 6th year.
Okay.
I graduated in 2018.
Okay. So you've been doing it for ages. So in that time, is there a common theme of when you have someone sitting in front of you, something you notice in most people, or something they ask you that you're like, here's a podcast now? That's why I'm asking you this. Is there anything that you notice that everyone asks you, or you think, oh, I wish people knew about this? Or is there anything top of mind that comes to you when I ask you that?
I mean,
does it hurt? I mean, is that a question people ask? Is this going to hurt me?
About getting an osteo session to start with. Yeah, I think people just want to know, like, essentially what to expect, or like main one is what's the difference between a chiro and a physio, and then it's just the vaguest answer ever. I haven't quite mastered my answer on that, and I always just like, well, I'm biased, but I think it's better. That's me though. On that response. I think, yeah, the main question is probably what is an osteo, to be honest, and then like why would you see an osteo versus someone else? But my answers to both of them aren't great, in that it's just so dependent on who you see and what you're seeing them for. So I always sort of think there's a patient for every practitioner and a practitioner for every patient. Like, you could see me as an osteo and then see an osteo down the road, and we'll just do completely different things with a completely different approach. But that was something an osteo told me once, was the only thing osteos have in common is they all think they're different. Yes.
I think therapists are the same. Yeah.
We all just use our own brains, and every brain is different. Like, yeah. I went to a Montessori school, and the motto for school was help me to do it myself. And that's just really stuck with me forever. And I think now coming back into osteo, where it really is, like, that's my goal for patients, is you can come and see me every week for your whole life if you want, or you can go home and do a few things yourself and not see me ever again. Not a great business model, but it works.
But also have a check-in with someone, because it's building a relationship. And we all know, or if you don't know, I'm going to share this with you now, your body is constantly moving and changing, and we're all heading in one direction. We're all aging, which sucks. But something with like osteo really, I think, is something that you've got to know yourself. You've got to, again, too, if you have something going on with your health, I really believe that you need to be your biggest advocate and go and see. If you've never been to an osteo before, go to one, find one, ask heaps of questions, and get a second, a third, a fifth opinion. Like, there's no harm in getting 12 opinions, because that's what I find most people don't do, is that I've got this, I've tried this, oh well. It's like, keep going until you find your person.
That's it. And often, like, even just like a personality thing, like, you've got to get along with the person that's helping you. Otherwise, I don't know, like, that's not a very nice kind of environment to heal. Like, you need to really trust your team and trust yourself that you know your body best. Like, if you think there's something not quite right, it's probably something not quite right. Or if you're like, oh, I shouldn't really feel like this, maybe I'm just getting old. Like, getting old doesn't mean you need to feel like gross in your body. Like, you can do something about that, even if it doesn't go away 100%. Like, you can still feel better within your body and still move better. But yeah, I do think, right, trusting yourself, and that you can have 10 people tell you 10 different things. You know your body best, no matter what degree they've done. Like, you know your body and what's normal for you or not, and just trust that. And I think a lot of what I try to do anyways, just bring that awareness into your body. What does it feel like when you do this? What does it feel good or bad or just indifferent, try things. Like, don't be scared to use your body how it's meant to be used, like experiment anyway.
Yeah. So if someone wanted to come to you and just get they've heard the podcast or they've got your details from somewhere and they want to come and visit you for like a all over check, like, is that something that you could offer too? If like there's nothing really going on, but I want to really improve my vitality and my health, and they might have one thing that's out, can they come and see you and have like an overall check?
Yeah, definitely. Sometimes we'll just look at the whole, and again, just looking at the whole system, be like, okay, what's moving, what isn't moving, what could be moving better, and just give your general system a boost. Like, I was like, you get your car service before it breaks down. Like, you can just come in and get a treatment, feel pretty good, get some, tips and tricks, do a few new exercises. It is, I really when I first finished uni, felt like a salesperson or something when I told people to come back, when I was like, oh, you should come back even if like you're not in pain, like acute pain. And you're always like, oh, am I just trying to get another booking, or do they actually have to come back? And I think only in the last like year or so even have I just got comfortable with people come in like every 6 to 8 weeks or something and just feel good. Check in. What are you doing? Keeps you sort of accountable as well, where it's, I'm going to do all of my exercises for 8 weeks and then I'll go to B and tell them that I've done them. You feel really good about that. And then, great.
Yeah, I can resonate with you on that. It's a lot of people think that they just go to therapy when there's a problem. And it's like, what I'm trying to educate my clients about is no, and a lot of people worry, I don't know what to talk about. Hey, that's what you pay me for. That's my job. So all you need to do is turn up, sit in the chair, and I'll do the rest. And they're like, really? And I'm like, yeah, because if you just come and see a therapist every time there's something wrong, you're not going to have the space to be able to put the things into place or move towards the goal you want. It's just you're staying stuck. So that's what I mean. Therapy is you come every, once every 6 weeks or 8 weeks or quarterly as like a check-in to keep maintaining, rather than these high highs and really low lows.
Exactly.
Like, let's try and keep this in the middle.
Yeah. And keep doing the things that make you feel good. Like, and everyone will know, like, you'll go and you'll get given a bunch of exercises, you'll do them until you're pain-free, and then you stop doing them, and then the pain will come back, and it's like, oh, I wonder why. Like, you stopped doing the 5 things that made you feel really good. Like, I think that's somehow trying to integrate that into just your identity, like your way of life is maintaining feeling good. However that is for you, like that can be different. It doesn't have to be TheraBand exercises every day. It can be anything.
We're not going for perfection here, are we? We're going for wellness, and we're going for feeling really good the majority or most of the time. And we're all human. We're all guilty of, oh, I feel really good. I'm going to stop this now, because that's what everyone can resonate with that. But when you said, as we start wrapping up this episode, you mentioned like feeling good, like it's good to feel good. I'm curious to know, like, because obviously my podcast and my business is caring for yourself and self-care. I'm interested to know what self-care means to you.
Wow. Different things on different days. I think, I've gotten very good at just listening to what my body actually needs, and like going to the beach, going in the ocean most days if I can is a must. And I start to get I can really tell if I haven't been swimming, I'll get a bit antsy and cranky. So swimming as often as possible in the ocean is definite. Playing with my little puppy dog, love her. Literally just getting home to her is self-care. Everyone buy a puppy.
Yes, everyone buy a puppy. I second that. Yeah.
I like going to the gym and just actually exercising and moving your body. And whether that's like gym or surfing or just walking my dog, I don't care, as long as like moving your body feels good. Eating well, like, and again, just ups and downs. Everyone dips in and out. Like, but just generally, you know what feels good for yourself. Eating well, drinking lots of water, going for a swim. That's probably the main things.
Beautiful. That's beautiful. So if people want to reach out to you and get hold of you to book an appointment and come and see you, because you are based, there's one thing I probably should have said in the beginning, you're based in the Illawarra, and are you based in Woonona?
Yeah, I've got a little clinic here with my business partner, Lauren, in Woonona. I'll get my Align Health Therapies. We're just opposite the IGA in Woonona. But there's a couple of osteos here, and we've also got a kinesiologist, which you've done an episode on. She explained it so well, actually. But yeah, so it's a nice, again, just a nice little practice of we all inter-refer to each other. If like, okay, you've come to see me, but actually Catherine or Lauren or Anna might be better suited. We'll just share around pretty well, which is nice.
Yeah.
Want contact details?
Yeah, people just like, obviously, are you on Instagram, and if you've got a website that people can visit?
Our website is alignhealththerapies.com.au. And then Align Health Therapies on Instagram, or my personal Instagram is bclark_osteopath.
Yeah.
Yeah.
Cool.
Got a few Instagrams. We all do something a little bit different here as well, so there's someone for everyone.
Yeah, and I'm just going to ask a question that some people, if they're not in the Illawarra, may be asking. Can any of this stuff be done online, or is it really something that you have to be in person to do this stuff with you?
Osteopathy, we only offer in person. Our kinesiologist, Anna, she does kinesiology, and I'm not sure actually if she does the Reiki online, but she does do online kinesiology appointments, which is really interesting. Yeah, but no, we don't do osteo online. Some people did during COVID, which I think just the way that I practice, I wouldn't be able to do my type of practice online.
Yeah, I just thought if someone's had the question. But it has been, I'm so glad that I got to spend time with you today and learn about this. And I am going to come in for a session at some stage so you can sort out my tongue and then everything else that's going on.
Right.
People are like, can you sort her tongue out so she stops talking?
Yeah, I'm just going to tie it up, shove it further down the throat.
I was like, I need it. But it'll be interesting, yeah, to do that review and just to, I'm really big the older I'm getting, especially now, once the busy time of year kind of falls back for me. This year is my year of health, and actually okay, now I'm really into my 40s. I'll put my business first, which some of us that own businesses at some point you do, and I've let everything fall aside. So now I'm like, okay, now I need to actually really put my health at the forefront to help me better. So I'm guilty of that. And it's going to be interesting to see, how these modalities help you in everyday life. So I'm so excited to try it. And if anyone else is listening to this, I cannot recommend, Belinda enough. So please message her. And she's really you just message her on Instagram, ask her any questions, and she'll, get back to you.
Happy if you're just curious about it as well to either just message and we can chat, or just have a phone call and chat if it's appropriate or not. But yeah, more than happy just to chit chat with anyone.
Chit chat and get the word out there that actually, because we go back to the beginning, osteo changed your life. And if someone is listening to this and you've got sore guts, you can't shit, you shit too much, you have a sore jaw, headaches, dizziness, hormonal, anything to do with those kind of elements, Belinda's your lady. But thank you so much for taking the time out of your day, because I know that you're busy, and to share with my listeners, finally, I'm so excited to say this is an osteo. This is what osteopath means. This is what osteopath does. You need to get an osteopath in your life.
Good summary. Love it. Thank you for having me. Finally, loved it.
Thank you so much for tuning into today's episode. I hope this conversation has added value to your self-care journey and inspired positive changes in your life. If you enjoyed this episode, consider sharing it with a friend who might benefit from this episode. Don't forget to subscribe on Spotify or on your favourite podcast platform to stay up to date on future episodes. Your support means the world to me. I genuinely love hearing from you, so please take a moment to leave a review. Let me know which part of today's episode resonated with you the most. Your feedback guides the direction of this podcast, and I really appreciate each and every single one of you for being a part of this community. To fall in love with yourself is the first secret to happiness. To find out a bit more about the Studio Chat podcast, head over to my Instagram page, Studio Chat Podcast, or if you want to find out a bit more about my counselling private practice, head over to Instagram on self_care_studio, or head over to my website, selfcarebybarbarathomson.com.au. I'm really looking forward to seeing you on the next episode. Until next time, take care of yourselves and keep embracing the journey of self-discovery.